Hello everyone, welcome to our podcast.
Today's topic is about digital health and civilians in China. I'm Henry and I'm the host for tonight. To start off, we're going to look at Bloomsbury defines the digital health. Digital health refers to the applicants of computing platforms, connectivity, software and hardware for healthcare and related use, whether it's targeted to individual patient, healthcare worker, manager, or system. From simple health promoting SMS messages to the smartphone app that can diagnose, track, and facilitate treatment for a variety of conditions. From algorithms to AI tools that uses big data to diagnose, treat, and predict diseases, track disease, and organize the delivery of healthcare. We will discuss the history of the health code policy, it is implemented, and the geopolitical issues within the country. I can also have some questions for Aaron and Lynn, who have living experience in China during the pandemic.
Okay, I'll start with a short introduction. All health codes contain three modes, green, yellow, and red, which is generally signaling healthy potential exposure to the virus and COVID positive cases. Users need to enter their travel history for the past 14 days to acquire a health code. In some local areas, such as Beijing, facial recognition is required to register. From what I read and heard from my friends in China, records of vaccination and PCR tests can be recorded on apps as well. The data is provided by the National Health Commission.
Interesting. So let's get started. So Aaron and Lynn, our discussion for tonight, we will talk about the Health Code app. Do you agree about the positive and negative in regards of the Health Code app? And then we'll cover your thoughts and feelings as you both have lived through the pandemic in China.
Most of the time, it is positive, I would say, because China is such a large country with 1.4 billion population. The health code can help the authority manage the infectious disease precisely, and they can also relocate the medical resource once they accurately know where the COVID case occurred.
Interesting. So you mentioned health technology part of the app, and I'm curious about the history of the health code and how it was used. Actually, I did some research about the origin of the policy. So on February 2020, the COVID-19 outbreak was reignited when winter break was over. So the government officer in Hangzhou suggested that issues of a health code. Am I correct?
Yes, absolutely. I came from Hangzhou and I witnessed how the policy was born and developed.
Wow, you witnessed the history here.
I know, it's amazing, right? But Shenzhen was the first city to use health code. And then on February the 15th, 2020, the coverage was enlarged to Hangzhou, Ningbo, and other cities in China. Speaking of Alipay, it was an app developed by Alibaba, one of the biggest tech companies in China. Millions of people are already using it for transactions, transportation, and food deliveries. So it is not hard for the government to add another QR code function to the app for COVID management. So the foundation is already there.
And I think the Alipay application is so strong. Just imagine an application that gathers the function of Apple Pay, Presto Cards, and Uber Eats. I can't go out without the Alipay app. Connecting the management of health code to the application's algorithms and the pre-existing function is a wise choice for the Chinese government.
Can you describe to the listener what's the health code page look like? How to use it and manage the complicated data about the cases, location, and medical tests?
Yes, I can. Basically, it is a health code with color, and if you complete your vaccination, there will be a sign in the middle of the code. Below the code, there is a section indicating your last COVID test and your test result. So every time you enter a public place, the security staff will check your COVID test to see if you're qualified to enter the space by your testing result.
So what's the testing requirement for entering public space then?
They will look at your code. If your code is green, you may be able to move without restriction and have access to most of the institutions and public places. If your code is yellow or red, you may need to have a quarantine during the code until the code turns green. Yellow is observation for a few days, and red is for a 14 days quarantine. Personally, I feel like it's quite safe to walk around in the public area because, if you are not sick and everybody around you has a negative COVID result, you will feel very safe.
Yes, I agree. Crisis control is actually good for Chinese society. The National Close Contact Database, the Regional Risk Classification Database, and the Personnel Location Database, which gathers location data retrieved from China's major telecommunications operators, have access to information about COVID patients. But there are also some negative impacts. Health code technology brings more inequality, especially between rural and urban. It also becomes a government surveillance tool, even contributing to deterioration. I feel very comfortable about this.
If so, could I invite you guys to talk about the geographical inequality of the health code within China?
Sure, the health code brings more inequality between rural and urban, brutal repression of patients. I can share an incident that I found on the news. Henan, China, is suspected of using health code to restrict the movement of some rural residents. Many farmers say they are being forcibly segregated and prevented from using public transportation or entering buildings. Most of them are rural customers of some banks. These banks have had problems providing cash withdrawals and have frozen deposits. This sparked last month's farmers' demonstrations. To suppress these farmers' demonstrations, the banks and the government turned their health code red. One rural woman from Henan said that once her status turned red, she was taken to a hotel for mandatory quarantine. She was not a customer. It was her father who had deposited money in one of the banks and now he could not get it out. As a result, the family turned red and was quarantined after her father participated in the demonstration. Over 39 billion RMB, which is 6 billion, was frozen, affecting hundreds of thousands of rural customers. This is a brutal crackdown on rural people using contact tracing. Banks and governments can use this to not return people's money that belongs to them. This reinforces the inequality between rural and urban areas.
Also, inequality of COVID testing is another issue. According to the article Disadvantage and Triage, some communities are more vulnerable than others. We can see how vulnerable populations struggle without the access to QR code technology. According to Statista, by June 2022, nearly 1.05 billion people in China access the internet via a mobile device. However, there are still 3.05 billion marginalized populations. I noticed that the direct relatives might represent some of the people who didn't have a mobile phone during COVID, and I saw some children printing out the QR code for doing a COVID test, as their test results may appear on their parents' phones. However, there are still vulnerable populations such as the empty nest elderly who do not know how to use the Alipay app and they don't have the relatives around. What are they gonna do to deal with their daily life? I mean, there are always communities who are left behind because of technology, and the pandemic policy only worsened the situation.
It's really distressing. Well, in this case, in addition to the inequality, the government, civilians also might be overwhelming, right? The telecom company have access to all the citizens' location, their personal information, and contact method. This is very different from the Western ideologies of individualism.
Yes, that is correct. The health code has become a surveillance tool for the government. Before the epidemic, Chinese government was already a surveillance powerhouse, and with the introduction of health codes, the number of cameras in China could be 1 billion by 2021. The information collected by Health Code includes personal information, username, cell phone number, ID number, and even face information. The Health Code system is shared with the Chinese police, and in some provinces and cities, the police are even involved in the creation of the health codes. However, while these are advanced on the surface, there are growing concerns about privacy. If the government's measures are still in place after the epidemic is over, this is a big risk for ordinary people. The government's pervasive tracking of people leaves them with no freedom or privacy. I know an example of excessive monitoring under the health code. A girl in Chengdu had her road mark searched and reposted on multiple social media platforms because she was positive, and many people denounced her routes for causing the spread of the epidemic. This made her apologize on social media, saying she caused trouble and broke everyone's peaceful life.
Yeah, you've brought up a great point, Lin. I went back to China in 2021 and I experienced a counter-cultural shock since I have been used to the non-surveillance or invisible surveillance during my stay in Canada. As soon as I arrived at the airport in Guangzhou, I felt like the big data was spying on me. I constantly received calls from Guangzhou government, the government of Zhejiang province, and the communication staff from my community asking for my travel trace and my personal information. I needed to provide my personal information to all of these quarantine hotels and local government.
I've never experienced this before, Erin. As far as I know, for the surveillance policy are very different from those in North America and Europe. I know in US they have a case investigator who would speak and survey and send you text messages from local state or from the local health department or by phone interview. The Canadian government developed an app which utilizes Bluetooth with an aim of letting users know if they have been exposed to COVID-19 or other exposed ways.
Wow, the political nature makes a lot of difference regarding the COVID policies between countries.
Well, then you mentioned a term that began with deterritorialization. Can you explain this term for everyone and talk about its connection with the Chinese health code?
In critical theory, digitalization is a process by which a social relation has its current organization and context altered, mutated, or destroyed. The components then constitute a new territory, which is the process of re-digitalization. Health code operates on the principle of digitalization, a social-political strategy used by the Chinese government to contain local power and cultural difference. Health code, an infrastructure that infiltrates daily life and repurposes data system, makes sure that COVID-19's biopolitical governing practice and formats are applied consistently throughout China. No matter where it is, everyone must abide by and use the health code. The health code has enabled the Chinese government to control and assimilate the entire domain well.
The example of deterritorialization is that the authority forced Xinjiang minority population to use the health code, as well as the quarantine. Recently, there was a big fire disaster in Xinjiang, which shocked the world.
And authorities are responding with more lockdowns, mass testing, and quarantine. And people here are getting more and more frustrated. Adding to that anger is a fire that broke out in the capital of China's far west Xinjiang region on Thursday night. 10 people were killed and 9 injured in a fire at an apartment building. Most parts of Xinjiang have been under lockdown for more than 100 days. The deadly fire sparked nationwide outrage because widely circulated videos, which have now been censored in China, show that COVID lockdown measures very likely delayed firefighters from getting to the scene. State media claims that people in the compound were allowed to leave the building. However, Videos show fire trucks unable to get close to the scene because the compound entrance was partially blocked. The video shows it's blocked with fences, tents, and metal barriers that are normally used as part of COVID measures. The video shows smoke and flames coming from a high floor of the building, but the water failing to actually reach the fire. What adds to the tragedy is that those who died in the fire likely spent their last 3 months largely confined to that building, if not entirely.
Xinjiang has lost its uniqueness and is about merged into one within central China through deterritorialization, even faces suffering and death.
And in addition to the cases you just mentioned, I also searched some of the news on the internet and found some recent tragedy under the health code. Under such enormous pressure, some Chinese people have been overwhelmed. An example I found on the web is Shanghai lockdown. Around March 27, 2022, approximately 2,000 people in Shanghai test positive for COVID-19. Although about 90% of the cases are asymptomatic, almost everyone in the whole Shanghai has become a red code and stop all activity. Starting from April 1st, more people health codes have turned red. They started being banned from all in and outs, including vegetable markets, hospital, express transportation, Disneyland. All have been suspended. Many people are in trouble because of the red code. Some of them have food shortage at home, and some elderly people can't seek medical treatment quickly. The patient of the people of this has reached its limit. To wrap up for tonight's talk on our podcast, we have mentioned both the positive and the negative side of the health code in China. For the pros, it helps the Chinese government find and isolate COVID-19 patients more quickly and efficiently, hereby reducing the number of cases. However, the con, it exploited the original equality, expands surveillance without privacy, and reflects a kind of deterritorialization by the Chinese government. It is safe to say many people living in China are getting tired of the health code and the lockdown, as they're very strict with zero-case policy and starving people or not allowing them to the hospital for weeks, making sure people are uncomfortable or even dying. That's all for today.
Thank
Thank you for listening.